Good morning. Thank you for joining us for our Northern Light Health's Good Health is Good Business Conference today. It is a pleasure to welcome you, as I truly believe this is going to be a very engaging and relatable hour. Today, we will be discussing the value of mentorship and succession planning in the workplace. I'm confident you will leave here today with new perspectives and considerations that may just influence your approach or your organization's approach to workforce development. I'm Karen Hawks, Vice President of Operations for Population Health at Northern Light Health, and I'll be your moderator for the next hour. Please join me in welcoming our expert panelists today. As always, I'm pleased to welcome back Dr. Jim Jarvis, Senior Physician Executive at Northern Light Health and Director of Clinical Education at Northern Light Eastern Maine Medical Center. And Dr. Jarvis will provide a brief health update prior to launching into the primary topic of today's conference. I'd also like to introduce Dr. Catherine McLaren, Vice President of Talent and Diversity at Northern Light Health, and Dr. Jason Harkins, Executive Dean of the Maine Business School at the University of Maine. Before we get started with today's panel discussion, I will read our legal disclosure. The information presented in this session is provided for educational purposes only and is not meant to substitute professional medical judgment. Northern Light Health does not know the particulars of your situation, so the information presented today is intended to be general in nature and may not apply to every individual situation. And Northern Light Health and the presenters make no guarantees or warranties regarding any information provided. So this hour is intended for you, and we welcome and encourage your questions at any time using the question and answer function. We also want your feedback. I hope each of you will take a few minutes immediately following this hour to answer our quick 5-question survey. Your input directly affects our topics and helps guide our future conferences. So with all that said, now I'd like to welcome Dr. Jim Jarvis to get us started this morning with a health update. Jim.
Well, thank you, Karen. Next slide, please. So unfortunately, respiratory season continues for us right now. This is a map of the United States that shows what the levels are of respiratory illness activity across the country is. I'll say that this is primarily looking at COVID-19, influenza, and RSV levels, though in some states they may report out and other things than that. If you look up at Maine, we are kind of in the darkish yellow, meaning that we are in the moderate category. So we are still seeing pretty significant spread of respiratory illnesses. And you may even, if those of you who've been on this call before, notice that I sound a little nasally too, as I'm just getting over a respiratory illness, not one of those big three that we just talked about. And if we look across the country about the percent positivity rates and compare them to where they've been in the past, certainly we are not as high in some areas as we were last year in December. But if you start looking at last February, March timeframe, we're actually a little bit higher across the country in all three of the categories of RSV, influenza, and COVID-19. Next slide. So how are we doing here in Maine? So if we look for influenza-like illness, and so those are illnesses that cause fever, so that really is going to be a combination of influenza, COVID-19, maybe a little RSV, and maybe some other things going on there as well. That dotted line is where Maine was last year around this time. The red line is where we are now, and the yellow line represents New England. And again, you can see that for both New England and for Maine, illnesses that are like influenza, we are definitely higher. And if you notice that tail end is actually on the increase, and that's because we're seeing more cases of influenza across the state of Maine over the last couple of weeks, and that's concerning. And that actually corresponds with the graph on the right, which talks about hospitalizations specifically for influenza. Again, much higher than we were last year and on the rise. So that's a cautionary tale for us that we are not at the end of respiratory season like we typically are right now. In fact, we're probably still in the middle of it. Next slide, please. So I did want to talk a little bit about, because I haven't done an update in a little while, about the consequences of the pandemic and vaccine hesitancy. I want you to notice the dates on these, other than the one in the upper left-hand corner that talks about an outbreak of measles in Central Ohio that was published on August 4th. Every other one of the articles that I have listed there, the dates are very recent. They're around February 12th, 13th, 14th. So we're just talking about just a few days ago that we have been hearing more about measles around the country and around the world. And that's concerning. And a lot of this has to do with an under-vaccinated population. I put measles here because I think people can kind of relate, but if we talk about many of the preventable diseases by vaccines, we're starting to see this troubling trend. The bad thing about this is that this probably will get worse before it gets better, because we'll start seeing more and more individuals, if we continue to talk about vaccine hesitancy, of people who are under vaccinated or not vaccinated, and allowing diseases that we have traditionally thought eradicated or at least under control coming back. I have been practicing for 30 years and have never seen a case of measles. Most of the resident physicians that I train and medical students have never seen a case of chickenpox, and that's because of vaccines have been so incredibly effective in preventing these things, but now we're seeing them come back again. I never thought that I would see a case of measles in my lifetime, and now I expect that before I retire, I will have seen several. So why do I bring this up with this group? Because I need you guys to understand that, to be supportive of your staff. If they do start talking about things that they've heard, please have them reach out to reputable sources to learn out more about vaccine safety and what we have accomplished through vaccination efforts. And then, of course, as you start negotiating out with your insurers for health insurance, that you make sure that routine vaccinations for both your employees and their families are covered. And with that, I'll turn it back over to Karen and see if she has any questions.
I do have one question, and Jim, I really appreciate the update. In terms of the influenza, is that also a result of lower vaccination rates compared to prior years?
It is. We've actually seen that both for COVID-19 and for influenza, the updated vaccines have had a much lower uptake than we've seen in the past. In fact, less than a third of the population in general across the United States have been vaccinated against either of those two with the current vaccines. That's very concerning. We really need rates much higher than that. Even more concerning is when we start looking at our population over the age of 65, who are much more vulnerable to catching the disease and having severe illness, that number is even lower. And it's even lower in our long-term care and nursing home facilities. And we're seeing that having long-term consequences for us, because we're having outbreaks of both influenza and COVID-19 in our nursing homes. And that's making it so that we can't discharge patients who are ready to leave the hospital but not ready to go home to those very same facilities. And it's having a backup effect. Some of you who've been on these calls since the very beginning we started this webinar, that's what I kept saying in the very beginning was the problem we were seeing with COVID-19. And here we are 4 years later, and we're still talking about the exact same problem, even though we have great tools to help prevent these diseases. So thanks, Karen, for bringing that up.
Yeah, absolutely. I mean, these illnesses are certainly hitting many, many homes in Maine this winter, and I'm glad you're feeling better. I think one last question: is it still worth, given it's mid-February, still worth getting the flu vaccine if somebody hasn't gotten it yet?
Yeah, I believe it is. And again, those numbers kind of tell us that. The other thing is that almost all of these cases are what we call influenza A. Typically in Maine, we see an influenza B peak happen after we've gotten through the winter months. So sometimes we've had an influenza B peak all the way into June. And thankfully, we haven't seen the start of that yet. But if it were to occur, the vaccine that's currently available against influenza would protect you against both A and B, and therefore would smooth out if we start to see an increase in that later on. So yes, if you haven't received your flu shot, still definitely okay to get that. And similarly, if you haven't had the updated COVID-19 shot, I recommend getting that as well.
Great. Thank you so much for that advisement. So Dr. Jarvis will be available at the end of our segment today during the Q&A. And so if you have any questions that you'd like to ask Dr. Jarvis, please use that Q&A feature and he'd be happy to address them at that time. I really do value the information that you shared today, Dr. Jarvis, so thanks so much. We are now going to transition over to the main topic of today's conference, and it's my pleasure to introduce Dr. McLaren, who will get us started by presenting on the topic of mentorship. So welcome, Catherine.
Thank you, Karen. I am really excited to talk about this topic because mentoring is near and dear to my heart, and I have benefited from some really tremendous mentor relationships, both as a mentee and also as a mentor. So we're going to talk, actually what we'll start with, because I'm interested in sort of the audience and what your experience is we're going to start with a quick poll. So if we can launch that. And if you would, please just put in your answers. You should see the poll pop up right on your screen. Okay, great. So it looks like 83% have had at least one person that you'd consider to be a professional mentor, which is great. I will tell you that about 75% of leaders indicate that a mentoring relationship was part of what they consider to be their success. So there's some consistency there. It's interesting, and I think this speaks to the wide variety of the types of mentoring relationships that can exist, that 6% of those of you who responded, it was a formal program, and about 94% were informal. Certainly informal professional mentoring happens all the time. And then let me just scroll down here so I can see. Okay, so it's a 50-50 split, which is great. So half of you have mentorship programs in your workplace now, and half of you don't. I'm going to talk a little bit about mentor programs overall. I'll talk some about what we're doing at Northern Light Health, and then just a last sort of some things to consider if you are tweaking or setting up a program, a more formal program. So next slide, please. So sometimes I have spoken with employers or, certainly HR folks who have said, well, we'd love to have a mentor program, but we don't think we're a big enough organization, or we don't have the resources for it. And at the end of the day, a mentorship relationship is really pretty basic in many ways. So it's a relationship between two or more people that really looks at knowledge transfer, skills, experience, or a combination of those things. It's usually over a longer period of time than, say, a workshop or a training, and it's based on trust. And probably the trust piece is one of the most important elements. Because what we know is that organizations that have mentoring programs have about 57% higher engagement and retention. So when we're thinking about it, I know those of you who are familiar with the data around our workforce and who we're hiring and who we will be hiring, a lot of people are looking for growth and development. So from my perspective, either a formal or informal mentor program is something that many organizations across all industries can start to integrate in some way into their organization. And it has a big return on the investment, which compared to other types of growth and development, the investment doesn't have to be as significant in my experience. Next slide, please. So the top benefits of mentorship for the mentees, it's really, as we would expect, professional development, a better understanding of organizational culture. I would say it also often helps mentees sort of understand, certainly build relationships, but also understand sort of what's possible. What are the career paths? It may not be obvious depending on how big the organization is. And then for the mentor, developing a new sort of perspective. And I can certainly say from experience that is something that has happened for me many times in the last, 7 years or so, where I have I've been paired with a mentee who has a completely different experience and position within Northern Light Health, and I learn a lot from them. And developing leadership skills, certainly. And then also, I would say, there's something really fantastic about someone succeeding and knowing that you had a part in that you were able to help. And so what we find is that our mentors often report enjoying the program as much as our mentees and getting as much out of it, perhaps in different ways. There are also benefits for the actual organization, and I mentioned one, which is higher engagement and retention overall for employers that have some kind of mentorship program. But in addition, growth and development of high potential employees. This obviously speaks to retention, but also we're going to hear Jason talk later about succession planning. And I think that having a mentorship program can actually help us start to identify successors as well. Certainly better relationships and collaboration. Anyone who works with me knows that I will often say that relationships are how we get our work done. And so even if some of what I do is very siloed, it's important for me to know who to reach out to. And it's important for those people to have some degree of wanting to help. And so if I've been able to develop those relationships over time, it sets me up to be successful, and it sets the organization up to be successful. And then certainly knowledge management and transfer. We know every time we have someone leave, whether they're retiring or moving on to another opportunity, they take a lot of institutional knowledge with them. And having a mentor program is one way for that transfer to start to happen long before hopefully either person is leaving. Next slide, please. So this, I put this in here really to illustrate the different types of mentor relationships, because that's the other thing. And we certainly know, I'm sure those of you who have programs that, and some of you may have employees like we do in healthcare who really have to be on site, but those who are remote, there was a concern in our sort of evolution of our mentor program of, what would it be like to have it be virtual? And really what this illustrates is that any kind of program really can work. I think if those other pieces, and we'll talk a little bit about sort of the match between the mentor and the mentee in a minute. But if that trust exists, then the sort of modality is less important. It may be important to certain people, and then, presumably we match them with people who have a similar idea about what success looks like. But it doesn't require that people get together, in person. It can certainly be done virtually. We have also had mentors who had a couple of mentees for a variety of reasons. That has worked just fine. So I think, the point here is that there's no sort of one size fits all. It really depends on the organization and, the resources and the people available and interested. Next slide, please. So our program, we began it in 2017, and we did a lot of research and a lot of work and created a lot of structure around it because we wanted it to be successful. And the lesson there, so we'll be starting our 7th cohort this spring, and I'm very glad to say that we've had a little bit of a gap, and during that gap, as we've been thinking about what we wanted to do next, a lot of people within our organization have reached out and said, when is the mentor program starting again? I want to participate either as a mentor or a mentee, which is heartening because, it means we're probably doing something right. At the same time, we have changed the structure and the content. I wouldn't say significantly every time, but over time. So we keep learning what works. And a lot of that is about the feedback that we get, and certainly just the experience that we have, and being open to changing it over time has made a big difference for us. So the pilot of a newer program, it's not completely new, that we'll be launching this year, is really about making sure that it's effective, of course, and I'll talk about that in a minute, and then also accessible so that people can really be part of it and stay part of it. I wouldn't say regardless of what else is going on in their lives, but making it workable so that it's not so much of a commitment that they have to pull out halfway through, which in the original iteration, it was a really big commitment. And there was a utility to that, but it just didn't quite work for our workforce. So next slide, please. Okay, so here are some of the key elements, and this comes from the literature, but also we've learned it over time. The first thing is that leadership really has to buy into it, because it is, there isn't significant cost at all external cost, but it is people's time and it is a priority. And if leadership hasn't bought into it, then it is easy for someone to say, well, you can, you have other things to do, so you're not going to go do that. So very early on, we made sure that anyone who was asking to participate, that their leader had signed on as understanding what the commitment was and endorsing it and supporting it. We continue to do that. That is not something that we've changed, and I think it just helps everyone set expectations going in. The second thing is that some structure and guidelines and expectations, including the why do we do this and the what are we trying to accomplish here, is super important, but with some flexibility, because people come into this program for a variety of reasons, especially the mentees. And so having some clear goals and objectives, and we publish, this is what we are hoping to create, but it's more about the space that we're hoping to, or trying to create for people to be able to have that relationship and to benefit from it, and less about specific goals around what you as an individual will accomplish. And in fact, part of the structure for us and the process is each individual identifying what it is that they are interested in, which speaks to properly matching mentors and mentees, right? Because some of it is personality, but a lot of it, and this is where there's so much variation, because there are some programs, and this isn't the one that we have, but it works perfectly well, where people are matched because they're in a similar role, and there's more focus on, in addition to sort of overall professional training, practical and technical training. So if I'm a medical assistant and I get paired with a more seasoned medical assistant, I may learn more about what it is that, I could be doing in my role. We actually take a completely different approach, which works well for us so far. And we're very clear that this isn't about your sort of practical and technical knowledge. We certainly support people getting growth in that area, and there are other programs for that. But what we match mentors and mentees on is what we've identified as sort of leadership competencies, such as fostering innovation, resolving conflict, building trust, acting strategic. So we have about 19 of these. And in the process of matching mentors and mentees, we look at what the mentees are saying they're interested in and where they feel like they have, where they believe they have opportunity, and what the mentors are saying they have strength in. And we match that way. The other thing we do is that we actually deliberately don't match people who are in the exact same profession, so to speak. And we also match people because we have many hospitals across hospitals for relationship building. And that's deliberate. So when we do our orientation, so we have these sort of calls that we set up before we launch the program, saying this is what the program is about, and here's how you can be part of it if you're interested. We're very clear about what it is and also what it isn't. We certainly encourage people to have more informal mentoring relationships. And of course, in healthcare, we have preceptorships where that exists anyway for the practical and technical skills, but this program is not that. And then we also really place an emphasis on mentor training and development, because mentors don't always know how to approach a conversation. We have some forms that we use around, to kind of set things up and have individuals identify their goals. But mentors also often have questions about if someone says like they don't know, they believe that they could develop their emotional intelligence skills, how should I be helping them other than maybe talking with them about some specifics? So we do have an orientation at the beginning for both, to really set up expectations and also help them with resources and how to proceed. Pilot programs are great. As it mentioned, I think on the last slide, we're piloting a new approach, which is going to be a smaller group this year to see how it works. And we're going to do 9 months this year. We had traditionally done a year, but we're finding that 9 months is going to work better. And then feedback and evaluation, again, it's an iterative process. We just keep asking what worked, what didn't, what could be better, what worked, what didn't, what could be better, and then evolving as we go. So I'm going to stop there, and there will be an opportunity for questions later if anyone has any, and I'll pass it back to Karen.
Thank you so much, Catherine. I participated in the organization's mentoring program many years ago, and so much has changed since, but it was a great program for me, and I actually still meet with my mentor on a monthly basis for coffee. So thank you very much for your presentation and that information. It is now my pleasure to introduce Dr. Harkins, who is going to talk to us about succession planning, which is an incredibly important topic for Maine businesses. So thanks for joining us, Jason.
Yeah, thanks for having me. And similar to the last presentation, I think we're gonna open with a brief poll. We can put that up. And so give you just a second to help me understand who the audience is as we talk about succession planning. All right. So as we can see here, who's in the audience today, we've got a CEO or owner, a number of people from HR, employees within organizations, and then other leaders from within organizations of our participants, and it looks like we've got about a quarter of organizations have a formal succession plan. About just under half don't, and then about 30% or so of you aren't really sure what your organization has. So if you can click to the next slide. The process of succession planning, while it has always been important and is something that organizations have spent a lot of time thinking about, and certainly an important part of business processes, has really come to the fore as recent statistics share with us just how much of leadership and ownership of many of the businesses in the United States are by baby boomers who are retiring and exiting businesses and leading to needs for succession planning in kind of record numbers. And we're talking about really big numbers. So nationwide, over 24 million employees and almost $1 trillion in payroll are generated by baby boomer owned businesses. And Maine is no exception as the oldest state in the country, with over 100,000 employees in our state and just over $3.5 billion in payroll being driven by those baby boomer owned businesses. So the context here is material, and we're seeing this happen across the landscape in the country and certainly in the state. Next slide. As we talk about what it is that succession planning is driven by, there's kind of two pieces. And so I want to talk briefly about the succession planning driven by an owner of a business exiting that business, meaning that that owner is going to leave the business, and there will be some next set of activities. And so that succession may be succession both for the leader and for the business itself. Before I talk about succession planning in an organization that is not owner operated. So in terms of our small business owners and entrepreneurs, the data pretty clear that many small business owners and entrepreneurs have all of their wealth, meaning their net assets beyond maybe a personal home or a car, tied up in their business, and they have not necessarily thought through succession or taken the first step in succession. And this is really a challenge because only 20% of all businesses that are listed for sale ever sell. There are other ways to exit from a business, but those tend to be what entrepreneurs expect to have happen and what their goal is as they are launching out into the world. So planning for that succession or for that entrepreneur's exit is absolutely critical, because it goes well beyond the impact on the value of a company, but there are many impacts for the leaders in terms of socio-emotional impact and what their experience is like in succession planning, as well as impacting a variety of stakeholders, employees very critically, but also customers and suppliers. Next slide, please. So it's not just that small business owners aren't thinking about or engaging in succession planning. We see, based on some data that has been published by the Society for Human Resource Managers, that only 21% of all organizations among those surveyed, which were larger and established organizations, have indicated that they have a formal succession plan, which is pretty close to in line with what we saw in our poll earlier. Another 24% said they have some sort of informal plan, similar to what Catherine was talking about, kind of informal mentoring. You know, we know that we need to do a thing, and we're talking a little bit about it, but we haven't necessarily formalized it. And then over 50% of businesses say they don't have a plan, and they intend to develop one, or they just don't have one. And this leaves this lack of planning has a real impact on the organization. And so we want to talk today about why planning is important and what the process looks like. Next slide. So there are really three types of transitions when we're talking about a business owner operator exiting and walking away. That means shuttering the business. And there have been some stories, actually, they almost always make the news when they just happen suddenly, but there's walking away. And this certainly happens in larger organizations where a leader for a variety of reasons, whether personal or professional, leaves, and the transition is just one day, we're not doing this anymore. There is a transition where you sell the business externally, or you go, in the case of succession planning for established organizations, you bring in an outside person to run the organization or become a leader of a big unit. And then the third mechanism is to move through developing your people internal to your organization, which can be a way to retain enormous amounts of value and continue with the culture and the institutional knowledge that exists in the organization as you look to grow into the future. The key to this whole planning for succession is that this is really a process, right? And so what we want to do is think about this much more as a stream than as a series of gates or dams. We want this to flow smoothly from one leader to another, where we are intentionally engaged in making sure that the continuity of the organization, continuity of decision making, enables the organization to continue to thrive and support the stakeholders that are so critical to its long-term success. Next slide. So if we think about it, really, succession planning is change management. It is a process of communication and then finding a way to build pathways so that we can bring everybody in the organization along as we think about how to transition to the next generation of leadership, and not have things be discrete events where all of a sudden something happens and we're engaged in succession plan, and we're engaged in a succession. We're not even doing planning, it just happens. We are interested in making sure that we're communicating, we're careful, we're transparent, and we talk about how this is going to happen, what the timeline is, and we really bring along all of the team, and we're not surprising people. And then we also want to make sure that in the course of this process that we're honoring the legacy of the leader that is leaving, because there are many people who have put in enormous amounts of time, energy, and effort in order to help the organization achieve the outcomes that it's achieved, that have been critical to its success and persistence. And so even when somebody is leaving, not necessarily having been the founder owner, but somebody who has been there for some time and has helped the organization achieve things, it's not just about honoring the legacy of that person for the sake of that person. It's about honoring the legacy of all of the work and all of the efforts that have been engaged in by employees and customers and suppliers and the entire community that has been impacted by that organization. And we really want to make sure that we're bringing the successor in as early as possible in this change management process to make sure that we're reducing impact, because one way or another, we're going to spend time in succession planning. When we don't do the work up front, and when we're not intentional and systematic in our processes, we end up doing the work on the back end, where we're trying to make sure that we're able to support and engage people and support those efforts as a new leader comes on board and needs to build relationships and understand the institutional context, what it is that's going to drive performance for the organization. Next slide. So after we acknowledge the fact that succession planning is fundamentally a process, we want to really think about, how do we identify the candidate? So many organizations, in similar ways to kind of informal mentoring, they may have an idea about who it is possible could be the successor of an organization, internally or externally to the organization. But the best successions happen when we have a very clear understanding from the top, not just about who is within the organization, but really who in the organization, or if we are bringing in somebody from outside, has the critical capabilities to lead your organization. As we all know, leadership in one context doesn't necessarily extend to the next context. And so when the existing leadership team can pull together and identify what are the key leadership traits, what do we expect them to do by way of types, amounts, frequency, approaches to communication, how do they think about the business, both where it is now and where it might be in the future? These are all the key pieces that are going to drive long-term success with the successor, because we have thought really about what are the predictors of success of our future leader. And it's really important to think about whether or not that person wants to be in charge. For many of us, it is something that we aspire to continue to grow and develop in our professional careers and to continue to move up our career ladder, but not everybody wants to be in charge. And we want to be really thoughtful as we are engaged in this process of identifying a successor. I recently talked to a family-owned business about this, and looking at transitioning in the next 10 years or so from one generation to the other. And they were really trying to identify whether or not the next generation in the family was interested in being part of the business and interested indeed in running it. And so they're starting those conversations now, which is really what you want to try and understand. It's important to consider where the firm is and then create a growth plan to support the development of that leader. So it takes a really long time as people move into those leadership roles where we are developing them, especially up into the C-suite, or bringing along somebody who's been an employee and who is now going to be an owner of the business. So we want to be really thoughtful about how do we spend a really significant basket of time, not only communicating with our internal team, but then also giving them progressive responsibilities and new perspectives on how it is that they can move forward and advance their own skills and capabilities to be equal to the task. And then one of the things that's become more and more clear, especially post-COVID, is that we certainly don't want people putting all of their eggs in one basket. So a recent survey in CFO magazine found that about 40% of leaders currently employed in an organization plan to leave that organization in 2023, which is a very, very high number. And so if we hand pick one successor and that successor, for whatever reason, chooses to leave the organization, and we're 18 months or 2 years into this process of developing and executing on the succession plan, we can be left now well behind the 8 ball. So we want to understand who are the people in the organization that might do it. We want to create a group or a pool of potential successors. We might have a preferred successor, but we want to make sure that we're working very hard on the process of bringing along more than just one person so that we're not vulnerable to that person leaving, whether willingly or otherwise. Next slide. So building systems is really the key to succession planning. Succession planning works best when the organization has systematic ways that it operates and manages its functions so that we don't have a lot of information trapped in the head of the leader of whether it's a business unit or of the organization. We want to make sure that as we're thinking about succession planning, we're doing everything that we can to take the things that only you know and make it so that more than just those pieces of what your business needs to do in order to really thrive. I was recently working with an entrepreneur, and they're in the process of trying to develop really a new and significant layer of leadership within their organization as they pursue doubling their business over the next couple of years. And that is requiring a lot of the current CEO to articulate, okay, I'm doing a lot of these things myself right now, and I might be the only one that knows them. So how do I start to get that stuff out and share it with the rest of the team? And we want to continue to think about where is the firm, and then think about how can we make sure that as much of these activities that we're doing, especially the really critical activities, are the purview of the whole organization and not just the individual. Next slide. So succession planning is interesting because we think a lot about succession plans, and that's why we asked that question at the beginning of this talk here, right? We see some of these formal plans. It's like the idea of putting together a strategic plan, which is built around doing a lot of hard work for a few months and then putting together a beautiful looking binder and then putting it onto a bookshelf somewhere for 5 years and revisiting it. Succession plans are often built in that same model, right? They're built as, here's the plan. But those plans don't then carry forward. If we're really doing this work and we're staying 3 to 5 years out ahead of when the actual execution needs to happen, we want to be focused on not the plan, but focused on the planning, because that planning, as Dwight Eisenhower said, is everything. It's the process of creating systematic knowledge, communicating, engaging, and then revising so that that living document can live with where you will be when the succession happens, instead of what you thought might be when you started in through the process. So it's really, we want succession planning to be a continuous process. We want to see that people are engaged in this all across the organization as we think about how we can engage in this continuous improvement and make sure that we are managing the change for the future that will be. And with that, I'll hand it back over to Karen.
Thank you so much, Jason. Just a wealth of information from all of our panelists today, and I really, truly appreciate you taking the time to share insights with us. Succession planning is certainly one that I think is a little overwhelming or scary for those who have never had to do it. So breaking it down into manageable bites and getting us that introduction is greatly appreciated. At this time, I would like to invite all of our panelists to turn on their cameras, and we're going to invite the audience to ask questions of you using the question and answer feature. So please do. I'm sure there was a lot of thoughts that might have been triggered by Catherine or Jason throughout their presentations. I'm going to start by first asking a question of you, Catherine, because I found the poll quite interesting that I think it was 94% of those that are in attendance today have been had a mentor, but it was an informal, in most cases, 50% of the time, right? It was an informal program or partnership relationship. As you launch this formal program within Northern Light Health, I'm sure there are instances where a mentee and a mentor might not be a perfect match, that relationship may not be evolving as we hope. How do you address that within the formal structure of a mentoring program?
Sure. Yeah, it's a great question. And of course that happens. And actually one of the things that we're implementing this time around is that we'll be checking in directly with all the mentors and mentees every other month to see how the relationship is going. Because one of the things that we've discovered, sometimes people will absolutely raise their hands on either side and say, like, this just doesn't feel like it's working well. And sometimes that's miscommunication or misunderstanding, and sometimes it's just not a good match, right? But sometimes people won't, and we'll only hear about it at the end. And so, remember, one of the three critical components is trust, right? So if that trust doesn't exist or is compromised in some way, then we will usually end that relationship. And we deliberately actually have a few mentors sort of waiting in the wings in case we need them, because it's one thing for a mentor to leave because they can't do it anymore, but a mentee who's expecting to be able to have a longer term relationship, we want to be able to provide that. So that certainly comes up, because the best laid plans, as soon as we start including people in those plans, that becomes complicated. But we have a couple levers we can pull to make it work for people.
Yep. So having a plan in place to address that. Thanks, Catherine. The next question is for you, Jason, and this is asked of our audience who has a curiosity about how municipalities handle succession planning or any other organizations that are supervised by a select board, and wondering if you have any insights into if there's resources available or certain procedures that might support that process, or any recommendations you have to share.
There are, my guess is that, like all organizations, municipalities have enormous variety in the level of intentionality that they have in terms of their succession planning. I think that there are a lot of resources. The Society for Human Resource Management has a number of really great resources around how to think through and build some of that succession planning activity. I think what we see as most critical, particularly in a municipal context, is that when we have long-standing employees in municipal roles with enormous amounts of institutional knowledge, And then we have select boards or city councils or other governing councils that might turn over more frequently than the employee. It makes the planning all the more critical because you're not sitting there with a backup to that knowledge, but indeed that person is holding a lot of the components of how the organization works and what its priorities are and why we do the things that we do and we don't do other things that we don't do. And so being really systematic and engaging that leader, whether it's a town manager or it's somebody in charge of economic development in a municipality or something like that, we want them to really articulate those pieces of information. And what's great about that is not only does it help with succession planning, it also then helps with onboarding of new members of the public who are coming into those elected roles or moving in and out of the organization. It helps to make sure that the knowledge is equally distributed across the organization.
Thanks so much, Jason. And I do want to just let folks know that the last slide of today's slide deck, which will be on our website, also has a link to the Maine Association of Nonprofits, which has a lot of resources around succession planning as well that I encourage you to look at that. And Jason, just to kind of build upon the concept of a board, what role does a board have in succession planning? And how should they engage in the process?
At the highest level, when we're talking about succession planning for a CEO, when we're talking about a nonprofit or for-profit organization, they play a very critical role because they are the ones who are identifying and working with the existing leadership to stipulate what are the core competencies that this CEO or leader needs to be able to execute on. And they are ultimately responsible for executing the succession plan because they will persist in the transition from the current CEO or leader into the next one. And so their responsibilities are really about making sure there's that continuity and in working with the CEO to identify what it is that they're expecting going forward and making sure that that's aligned with the strategic planning that the organization is pursuing and the outcomes that it desires to achieve.
Great, thank you. Catherine, the next question is for you from an audience member. Wondering if mentoring programs are most impactful for those in particular career stages, or if they're equally beneficial across all levels of experience.
Yeah, so I would say one of the myths about growth and development is that we get to a stage either age-wise or in our careers where we're no longer interested. The data don't bear that out. There are, of course, some people who say are close to retirement and are kind of like, you know, I'm good, you know, like I'm going to be done in about a year and I maybe don't have as much, but that's not necessarily true. And actually what the data also tell us is that we sort of stop paying attention to people after a certain number of years of tenure. And we really think more about the people coming into the workplace. So what I would say is, it doesn't, anyone can be interested in it and may well be, and we want to take that into consideration. What they're interested in may be somewhat different depending on where they are in their career and what their, you know, what their goals are. But I would not discount any group of people unless someone says, I'm not interested.
Right. Yeah, thank you. And Jason, I'll toss this question to you, but also invite Catherine to chime in given her role in human resources. I'm sure she has experience with this as well. But I think that it's maybe safe to say that some leaders are a little hesitant to announce their planned departure for fear that it might, you know, inadvertently impact their influence at the table. And so can you address that a little bit? Because 3 to 5 years planning is quite a bit different, or I think might have people a little surprised that you're recommending 3 to 5 years of planning.
Absolutely. And that goes back to that kind of socio-emotional cost of succession planning. It requires a leader with a maturity to engage in that much kind of forward-looking work, recognizing that, acknowledging that we will not forever be with our organization is not an indictment of us as people or as leaders, but is a recognition that that we are presumably doing really good work, and that we are looking to maintain and prioritize the outcomes of the organization over kind of holding that close, which can feel like the thing to do in order so that I can get my key initiatives across the finish line. But it makes the organization much more vulnerable, and we can start that work by, to your question earlier, kind of managing up whoever it is that we are reporting to. When we're starting to have those conversations, again, this is planning. I'm not saying I know that in 4 years, 6 months, and 2 days, I will be leaving, so there you go. I'm saying, look, I'm reaching a point where I'm exploring other opportunities, or I'm moving toward retirement, and I want to make sure that I'm bringing up that next generation of people behind me, and then having confidence and communicating clearly that this is not abdicating responsibility, it's not walking away from anything, but indeed it's believing in the opportunity to continue to enhance the outcomes of the organization. But it can be very scary to be seen or worried about being kind of a lame duck in the organization.
Yeah, I could see that being a challenge, and I also think that there might be a perceived risk of selecting a candidate and feeling as though you're locked into that selection, and how do you communicate that to others in the organization? I mean, there's just a lot of those factors to consider and navigate, and I think any guidance you might have to help with that would be appreciated.
Well, as I think, and I know Catherine's got some thoughts on this, but I think that the key, as I said before, is not to pick one person, but if there are a variety, a few people that might be able to fit into that role, starting that work and engaging them early is important, because we want to make sure we're developing those capabilities and we're communicating about it. But it certainly speaks to the importance of setting clear expectations about, or being very clear about what you are and are not communicating. You're not saying you've got this job at X time.
Right. Thank you. I really appreciate your time. I am going to throw the last question to Dr. Jarvis, because we do have a question from the audience about measles. So Dr. Jarvis, hopefully you're still on. I think
I
you
am.
are. Okay, good. I see you now. Do we have to be scared in Maine about the measles? And is there any other booster for the MMR vaccine? Is there a booster?
Yeah, so for most individuals, if they've completed their series as a child for mumps, measles, and rubella, they are covered for life. Very different than we talked about with other vaccines, and that's simply because those viruses are very stable. They do not change over time, and that's good news for us. Occasionally, the CDC will make recommendations because of an outbreak in a particular community that maybe certain personnel need to get a booster shot. Right now, I'm not overly concerned here in Maine, other than the fact that we have travel coming up next week for most schools that are on break. And so there's always that possibility of somebody bringing something back to Maine. And so it just really continues to bear watching from people like me. And then we will spread that information out if we need to people like you.
Right. Awareness is appreciated. So thank you so much, Dr. Jarvis, and thank you so much to all of our panelists today. Really, truly appreciate your time and expertise. It's been a fascinating and engaging hour for me. So I've enjoyed it, and I'm sure our audience has as well. I do want to invite you all to please complete the survey that you will receive in your email inbox. That information is incredibly important to us. All of our sessions are posted online. If you have any interest in seeing any of our previous webinars or sharing this webinar with one of your colleagues or friends, It will be available next week. Our next session is March 21st. We will be discussing an emerging public health issue in Maine, and that's tick-borne disease. So I hope you're able to join us. We have some fascinating experts joining us to help educate us, and with spring approaching, the timing is perfect. So please consider joining. We'll send you the link, and I also encourage you to share it with your friends, colleagues, and any others who might benefit. Thank you so much, and have a wonderful afternoon.